afternoon, everyone. Hello. Since March, all of our resources, whether medical, municipal, government, and personal, all of us at the individual level, in our buildings, in our societies, and in our homes, we have all been focusing on fighting the COVID-19 outbreak. It's been essential, the need of the hour. But as all of us have also experienced in these last few months, natural disasters and diseases are not under lockdown. And now, as the monsoon season begins here in India, whilst our healthcare systems are already stretched, this is the time when infections like malaria and chikungunya and dengue, which are collectively known as vector-borne diseases, VBDs, become rampant. That is exactly what we are discussing today. It's time to stop the spread. Let me introduce the panel that we have for us this afternoon. I'd like to begin by bringing in Dr. Bhupendra Tripathi, the country lead elimination programs for neglected tropical diseases at the Bill and Melinda Gates Foundation. Good afternoon. Second, we have Mr. Neeraj Jain, the country director for India for PATH. Third, we have Dr. Kaushik Sarkar, the technical lead for India for Malaria No More. Number 4, we have Ruchita Shah, the founder and CEO of First Mobs Club. Number 5, we have Sunil, Kataria, CEO India and SAARC for Godrej Consumer Products Limited. And finally, I'll be your host for this afternoon. My name is Dr. Ranney, and I'm the General Manager of Thrive Global in India. So to everyone joining in, to all of my esteemed panelists, thank you so much for being with us today. My first question, if I may, will be pointed towards Dr. Kaushik. Dr. Kaushik, if you wouldn't mind just setting the scene for us and helping our viewers and all of us understand what exactly are vector-borne diseases, these VBDs, and why should our viewers even care about them?
Vector-borne diseases are diseases that have an intermediary agent in between in the chain of transmission. So during COVID-19, most of you are aware of the term break the chain of transmission, even if you are not a doctor. So in vector-borne diseases, it doesn't spread from human to human. It's spread through an intermediary agent. It can be mosquito, it can be ticks, it can be bug, and so many other insects are there. Now, those insects actually take the agent, it can be bacteria, virus, or parasite or anything, from your body and will actually transmit this to some other person when they bite that person or when they come into contact of that person. So that essentially is vector-borne diseases. And I would like to add one point, that the importance lies in the fact that since the evolution of mankind, mosquitoes among all the vector-borne diseases have killed more people than the words across the world.
I'd like to invite Dr. Tripathi in here. And if you could help us really understand how these diseases manifest themselves. You know, as a layman, what are the signs and symptoms that I should be looking out for that will help me understand whether I've got one of these and also whether one differentiates between the other?
Thank you, Marcus, and good afternoon to everybody here. So the question you have asked on the clinical background, I will take a step back and explain to you. It also depends upon the geography, where do you live. So for example, we will have fever in all these three diseases, whether it is malaria, dengue, or chikungunya. But the likelihood also depends upon the geography from where you come from. For example, if somebody is living in a remote area, tribal area, hilly area, and the person is having fever, and the fever is having some sort of episodic pattern, the person is also having a lot of sweating, and after the sweating, the fever comes down. So what happens? We have a inclination towards malaria. If you come to the urban landscape, it is more of dengue and chikungunya. In dengue, what happens? There is a fever which comes up like high-grade fever, and along with the fever, there is a severe backache, and there is a sort of pain behind your eyeballs also. For chikungunya, fever will definitely come in. In addition to fever, you will also find a severe joint pain, and that joint pain will happen across all the joints. And that joint pain is so bad that sometimes you can't even stand by yourself. So the posture which we have is a stooped posture. And in Africa, this particular stooped posture is the word which is chikungunya, which has been given to that. And last point, chikungunya pain usually subsides over a period of time, but there have been cases where the pain persists for long.
And I think it's also important for us to appreciate that given that we are so, our sense of heightenment is there around COVID-19, that every fever is not necessarily coronavirus. Kaushik, if I could bring you in, obviously the work you're doing with Malaria No More across the length and breadth of India for a number of these VBDs, help us understand, what are the geographic hotspots for some of these diseases? How does it change with time? What is the seasonality that we should be really cognizant of as individuals?
Now, in terms of spread, although these diseases are spread by mosquitoes, they do not overlap mostly with each other. So, for example, historically, malaria is a rural and tribal disease. Although lately, after urbanization of India, it had severe urban outbreaks. And it keeps on changing. The geographical spread also keeps on changing. So for a few years back in 2016 or before that, the state of Odisha used to be the highest burden state for malaria in India. But we have seen large outbreaks in the state of Uttar Pradesh in the last couple of years. So there are two different types of malaria. One is caused by falciparum, which is more in the rural and forested tribal regions of India, the central part of India, as well as the northeastern states. And also there is an urban malaria, which is caused by vivax, which is more localized in the cities. So that essentially means people in Kolkata, people in Mumbai, people in Delhi, they are more affected by these urban malaria. Now, in terms of dengue, the distribution of dengue, geographical distribution is more or less similar to urban malaria. Of course, there are having differences in the exact geographies, but they do overlap. And then again, there is a surge. And there are several components that affect this cyclicality of the disease pattern. But we need to be mindful of both the seasonality as well as the cyclical spread.
In India, the traditional efforts by the state to do fumigation, mosquito control, etc., have been diminished. Singapore has seen a surge of 50% cases. Bangladesh has seen big surges already. Please weigh in. Tell us a little bit about what's going on within the region, within India.
I think vector-borne diseases are going to be a huge challenge. Most of the programs you've heard from Bhupendra and Kaushik, most of the programs have been they've not really done what they usually would do at this time. We are starting the monsoons now. The rains are coming in probably a little bit also early. We haven't actually done the necessary preparation work for it. And it is surely going to have a problem. I mean, so if you look at malaria alone, India is in the top 11 countries in the world. You look at dengue, chikungunya. We have actually grown by 500-600% over the last 7-8 years. The expectation this year, and if you mentioned Singapore cases have doubled between last year and this year. India is definitely going in that direction. So I think what I think needs to be done is a lot more focus needs to go back to the vector-borne diseases. Of course, COVID is not over. I live in Delhi, and I believe Marcus, you're in Mumbai, so we are in the hotspots of COVID. But I think we cannot let all this hard work go down the drain. We've got to make sure that we immediately take action. And there has to be, the government system is gearing up. They have a new strategy. They are moving in the right direction of saying, while COVID continues, how do we work towards ensuring the vector-borne diseases? We have an elimination program that is time-bound, and we don't want extensions on that. So yeah, I think we really need to be aware. And you mentioned this earlier, but dengue and COVID actually are very similar, both clinically or in a lab. So and same fever, same sort of symptoms. So we really need to get on with our act to make sure that we are managing the vector-borne disease.
Ruchita, we've now therefore understood that this is an essential conversation for our public health and for our individual lives as well. Tell us, based on the intelligence on your platform, the conversations that are happening, is this up there in the priority list, or where does this conversation stand in what moms and parents are talking about right now?
This is not priority right now, unfortunately, because I think the Indian mom is so overwhelmed with the whole COVID discussion and how does she keep her family and herself and everybody safe, that right now she's not sharing or even discussing anything related. So we did a quick poll on our community to ask whether they were actually worried about this, but they actually, 95% of them are only thinking of COVID. And the main topics that they're discussing are, I know this is not going away, so how do I increase or how do I make the immunity of my child great? That's one thing that they're discussing. So right now, she's not worried because she thinks that COVID is the biggest monster that she has to deal with. So unfortunately, this is not a topic that's come up, which used to come up till last year around this time, where people are trying to figure out, do I send my kid outdoors to play or not? They feel that if you're at home, you're kind of safe. It's only when you go outdoors and there are mosquitoes and stuff like that. So I think, but yes, the rains have just started. It will get worse.
I'd love to bring in Sunil here at this point, because one of the biggest learnings for all of us from the COVID pandemic has just been the interconnectivity between public health and the economy, right? We used to each think that health was my own personal thing and I need to be in control of it. And now we're seeing globally this sort of unravel itself, and for us to look after one another, because the economic and the business impact on all of this can be profound. Neeraj already pointed out in terms of the disease spread in some of the South Asian economies, etc. For giving us the insight from the business world, how geared do you think, Sunil, we are to face these challenges right now in India?
Dengue has been on the rise by almost 3 or 4 times over the last 5 years. In the country. There's a study which happened in terms of economic impact, if you're talking, that the social economic burden of vector-borne diseases in country could be anywhere between $3 to $4 billion in our country. Now, that's a huge impact even in a pre-COVID scenario on an ongoing basis. Now, obviously, post-COVID, what it does to the slowing down or maybe recessionary economy, I mean, nobody can right now predict. But that's the kind of challenge that we are dealing with when we are talking of vector-borne diseases. That's what it does to our country. Secondly, our country has its own set of patterns which are so unique to it. And the moment we step outside our physical homes, the rest of the country is not ours really from a civic sense. We'll do a lot of stuff to do all the great things in our homes in terms of cleanliness. But the moment we step out of that home, it's a dustbin outside for us, right? And that's a very fundamental challenge of our behavior in this country. Till we do fundamentally strong corrections in these attitudes, it's a battle which is a long battle for us to control vector-borne diseases. Second thing which happens is, this also shows another behavior of ours, which is very tricky, is that we tend to take diseases by and large lightly, as a country. And I'm not talking only for urban India, it's actually for the large masses of India is rural. It could be partly got to do with poverty, it partly got to do with illiteracy. So we just tend to rely a lot on home remedies and home preventions as a country. Now that's another phenomenon, which actually makes life very tough. And third, we do not do enough of personal protection as a measure. I think even in a normal year, vector-borne diseases are a challenge in this country. No wonder our social burden is $3 to $4 billion. And in a post-COVID situation, there's a fourth variable which has come into the play. And that variable is very clearly that the government bodies have been very, very active in the past, at least last 5 years, I would say, in terms of taking fumigation measures, in terms of doing pre-monsoon cleaning of drains, in terms of educating consumers, in terms of supplying nets. A lot of measures have gone in place. And unfortunately, thanks to the large COVID battle that all the government agencies are fighting and all the municipal bodies and all the district commissioners are fighting, and they're fighting some heroic battle out there, all these pre-season prevention measures have had to take a backseat. So we are sitting on a very tricky situation in terms of vector-borne diseases right now.
The organization Godrej has been significantly involved in helping manage these agencies, vectors for so long, whether it's the formats that you manufacture and the other initiatives that you do. It would be great to shed some light in terms of what that essential work that you've been carrying out over the last few years and particularly some of the benefits. What is the impact that we've seen from those efforts?
Yeah. So, okay. So there's one program which I definitely would like to share with the audience. And I think something which is we are pretty happy to see the results of that. So there's this program which we call in an acronym as Embed. What it stands for is Elimination of Mosquito-Borne Endemic Diseases. And this is a public-private government partnership, which I think is really come to a strong success of its own, where we are working with governments of Madhya Pradesh, Uttar Pradesh, and Chhattisgarh since last 5 years. And this program has panned out since 2016 onwards. And today we have covered around 9 districts in Madhya Pradesh, 2 each in UP and Chhattisgarh. The whole objective of this, and we work with NGO Family Health India. And this program is aimed at actually creating 3 things. The objectives are first to create awareness about vector-borne disease, or what is malaria itself, or what is dengue itself, because people don't understand that. So that's one objective. Second is driving through this awareness change in behavior, because people, even if when they have fever, they don't report it to the nearest, Anganwadi or to the nearest Asha worker. So that second behavior change objective is, okay, they actually start doing reporting of these diseases. The third is in behavior change, we also look at helping them understand what could be personal protection measures they can take and how to use them. And the third objective of this is obviously building capabilities for the local health corporations and the whole local health workers and equipping them to do disease monitoring. Now, Indian government has done some fantastic work over the last 5-6 years in distributing long-lasting insecticide nets across. But unfortunately, in many studies we've seen these tribal rural people, they don't even know what to do with these nets. They don't bind it together. They end up getting used as fishing nets. They end up getting used in summers outside. So I think this program, we have tried to actually educate them also on how to use nets. There's a 58% increase in usage of nets. And the biggest piece, which I think really makes us happy, and that's why this program we are expanding across to more districts, is we did one study about top 17 cities, not even urban, top 17 cities of India. And we did study among moms saying, okay, what do they understand about dengue? And only 80% of people did not know that dengue is a day mosquito. Now that's one challenge in India. Another one. All of us associate mosquitoes with evening time. That's the reality. So we take precaution, whichever place we take precaution, 6 o'clock, 7 o'clock, shut windows, put a coil, put a liquid vaporizer, and then till morning you're kind of safe. There's a mosquito which comes in day, and that's dengue. It's not a mosquito, it's not a malaria mosquito. And then we had done a very large education program, which we actually was a branded program by us, which we called as Subha Bolo Good Night. It was a nice marketing thought that we brought in, where we try to educate moms and urban moms especially, that there is a mosquito which your child or your family is prone to, which comes during day. And that large program was backed then by a lot of school awareness campaigns, because most Indian moms, they feel very particular about protection of their families. And by doing this evening regimen, they're able to take care of, they felt a huge amount of satisfaction that I have done my responsibility of protecting my child. The biggest risk child also has when they step out to school, because dengue is a day mosquito. So I think that's another awareness program which we've done. And the third one is within dengue regime itself is, again, most people in India don't understand the difference between blood donation and platelet donation. So what we have done is, along with Apollo hospitals and Godrej, we have created a platelet donor community in India called HIT, Apollo Platelet Donor Community. And today we have been able to enlist in 7 cities around 1.5 lakh regulated platelet donors. And over the last year or so, there have been quite a few number of lives we've been able to, save because of this helpline of platelet donors, which is available, and the entire extrusion, etc., of samples can be easily done at respective Apollo healthcare centers. So I think these are some of the work that we have been doing.
PATH does a lot of work with states and central government, etc. What's the message that you'd like? I'm sure they're tuning in. I'm sure the health minister is watching this show, and otherwise we'll make sure it gets to him. What's your message for the authorities out there?
I'm going to simplify. We are almost out of time. So, money, definitely. At the moment, the budget allocation is about 69,000 crores, which is 1.6% of GDP. We need to go up to 2.5 as committed. And I think that's going to happen. Again, one of the benefits, although I shouldn't be saying that very often, we've also got to invest more in tools, mechanisms. There are digital tools that are out there. We are seeing some sort of drug resistance, so that's going to be there. And of course, eventually vector control. I mean, Sunil's talked about it, but of course he's got a company to run. But largely, we really need to focus on vector control across the board.
Now, as the lockdown comes out, I'm sure everyone is going to be already using more sanitizers, wearing face masks, hopefully washing hands, etc. Do you think, however, that prevention from these vector-borne diseases will get enough awareness to hopefully stop the spread?
Yeah, okay. See, I'll tell you first of all, COVID outbreak is not over in this country, obviously, and I think it's something which we'll all have to learn to live with. But if there's one thing which positive may come out of COVID, I think it will lead to a shift, definitely, to India's attitude towards hygiene and cleanliness. And along with that, I think India's proactiveness towards disease prevention. I think that's one thing which I'm hoping for, that will be a fundamental residual effect that we will see in this country across. What this will require will be a lot of effort. One is, I think, continuous education is the biggest piece in this. And this education has to be done not only by governments, it has to be done by all bodies. It's not going to be an easy one, but I think habits don't change easily. Habits require some fundamental interventions to change. Maybe COVID could be providing us that opportunity.
So yeah, thank you. And so folks, our time together has come to an end. It's always one of those things where I wish I had more time because there's so many more questions which have come up. But our panel of experts have really helped us navigate a very complex issue and provided us with some very simple steps to protect ourselves against these infections. Whilst we continue our focus on our collective energies against COVID, let us now hopefully be aware of the other health challenges we face and the way that these can adversely affect our homes and our offices as well. Prevention really is better than cure, and the power to stop the spread lies with each one of you. I wish you all safe health, stay healthy, until we see each other soon. Thank you very much for joining in.